Magandang hapon po. Thanks for joining us. Today is a Thursday, and we are still celebrating October as Breast Cancer Month. I'm Dr. Ana York Bondoc. Our program is called Libreng Consulta, and you are very welcome po to send us questions about breast cancer. Today po, our topic is very interesting and also nakakataba po ng puso and very touching. And it's about stories po of breast cancer. So, we are live on YouTube, we are live on Facebook, and please follow us po also on TikTok. And please put po yung stories nyo po. If you have any kwentos about breast cancer that you would like to share, ilagay nyo lang po sa baba and we'll be happy po to answer them. Today, I am joined by two wonderful ladies. Actually, one of them is my cousin, Miss Emily Aliwalas Bais, and her mom, Tita Purit Aliwalas Bais. And Emily po is a survivor of breast cancer and an advocate. And her mom po, yan ang talagang kasama niya po during her cancer battle. So we're happy to have them join us. Thanks, Emily. Bumati ka naman, pinsan.
Hello, Ate Ana. Hello, everybody. It's so nice to be here. It's a pleasure, my pleasure to talk about breast cancer. Sana makatulong dun sa mga may worry at saka merong pinagdadaanan. Hello, kamusta?
Ayan, that's my very, very pretty pinsan. And my very, very pretty tita, Mrs. Purisima Bais. Tita Purit, how are you? Tita Purit Aliwalas. I'm an Aliwalas from Arayat, okay? So, Tita Purit is the first cousin po ng daddy ko. Very close na pinsan. I've known her all my life. And I'm happy to guest her. Tita, bumati naman po kayo. Ayan, nakamute ata si tita. Tita,
Hello,
press
Ana.
niyo po.
Yeah,
Hi!
hi. Hello, Anna. You're so pretty today. And hello, everybody who's in tune. Good afternoon.
Ayan. So, thanks so much for joining us to my pinsan and to my tita. And actually, si Emily is a breast cancer survivor. My tita is the mom of a breast cancer survivor. And ako po, I'm the daughter of a breast cancer patient. So, mag-sharing po tayo ngayon and hopefully that you can learn from our experience. Sana po may ma-pick up din po kayo for your breast cancer journey or even just for awareness. So, basahin ko po yung ating letter. Dear Dr. Ana, ako po ay a newly diagnosed breast cancer patient. I'm married with young kids. Paano po ako makakakuha ng lakas para sa aking, I know my breast cancer battle is just beginning. I am about to be operated on, pero parang nangangailangan ako ng lakas ng loob. And how do I get the support from my family and friends? So please help me, Doktora, Miss Emily, and Tita Puri. Ayan. So that's our somebody who needs support and lakas loob. So Emily, siguro we start with you kasi ikaw ang breast cancer survivor. How did it
Sure.
start? Oo, what
Well,
happened?
nung na-diagnose ako, unang-unang tinanong ko sa doktor, what will happen to my kids? Yun kagad. Hindi ako nag-isip ng what will happen to me. Ang inintindi ko talaga, because they are also young. So parang, and I'm a single parent. So ang worry ko, sino mag-aalaga sa kanila? I have my family. So nakakatakot, normal matakot. Walang hindi nakakatakot about knowing na may cancer ka. Kasi cancer, 'di ba, syempre, ang alam nating immediately pag cancer nakakamatay. So parang sinabi, binigyan ka na ng death sentence. So paano ka kukuha ng lakas? I think number one for me was my faith. Kumapit talaga ako kay God, kay Mama Mary. Sila yung tinapitan ko. Second is my family. I have a very strong support group, my family and my friends. Pangatlo is you need to educate yourself about what you're going through. Okay lang mag-Google, pero wag mong paniwalaan lahat mababasa mo. Use it para you can ask questions because it's important na you understand what you're going through, what you will go through, and what you need to be successful in your treatment. Kailangan talaga buo yung loob mo. Kasi ang pinakamahirap sa cancer, yung nagdadalawang isip ka, gagawin ko ba to o hindi? Ano ba yung gusto ko o hindi? Dapat huwag kang matakot. Dapat excited ka. Kasi pag alam mo na magkikimo, nakatakot kasi chemo, nakatakot ang surgery, nakatakot lahat yon. Pero kung yung pag-iisip mo, gagawin mo na, yes, gagaling na ako kasi pag inoperahan ako, matatanggal yung cancer. Pag nakimo ako, mamamatay lahat ng cancer sa katawan ko. So, gagaling ka. Meron ka lang kailangan pagdaanan. Pero pag dinaanan mo to, na buo yung loob mo, buo pananampalataya mo, mayroon kang mga kaibigan at saka pamilya na susuporta sa'yo. Kailangan honest ka sa nararamdaman mo. Huwag kang magtatago. Huwag kang mahihiyang umiyak. Kasi nakakaiyak yung cancer. Nakakatakot. Ako, ilang beses ako umiyak. Umiyak ako sa simple things like food. Kasi pag nagbasa ka sa Google, sasabihin, bawal ito, bawal ito, bawal ito, bawal ito. Ano nang kakainin ko? Dahon. So, alam mo yon, umuwi ako, I remember, umuwi ako isang beses galing sa office, pumasok ako sa kwarto ko, tapos iyak ako ng iyak. Tapos pumasok yung mama ko, kasi yung mama ko, nung nagkasakit ako, lumipat sa bahay ko. Tapos sabi niya, why are you crying? Tapos sabi ko, because I'm so hungry. Tapos wala akong makain sa opisina because lahat bawal. So, those simple things na madaling gawin dapat pag normal buhay mo, biglang bumabaliktad. So, educate yourself. What can you eat? What can you not eat? Also tell the people around you. Dapat alam nila. Kasi sila yung tutulong sa'yo. Huwag kang magtago, mag-isa. Huwag kang mahiya, humingi ng tulong. Importante yon. Pag meron ka nun, madali labanan ng cancer.
Yeah. Family support and faith in the Lord. Oh, Emily, tell us how it started. Ano yung nakapa mo? What happened? Oo.
Yung nakapa ko, yung sa kilikili. Sa kilikili.
Okay.
Dito sa left arm ko.
Not
pero
sa breast, kilikili.
Not sa breast. So, at saka hindi siya sa ibabaw ng kilikili, sa ilalim. So, kailangan dumukot pa ako. So, kung normal mo siyang hahawakan, hindi mo siya mararamdaman. So, importante, ang ina-advocate
You told
ko,
us, yeah.
Yes,
you told us you waited 2 years. Ikwento mo nga, Emily. Why did you wait 2 years? My gosh. Oh.
Nakakahiya kasi ang ina-advocate ko ngayon is early detection. Kasi yun nga yung natutunan ko. Nung nakapa ko siya hindi dahil nagte-test ako. Kung hindi dahil may biglang parang sumundot na pain. Parang gumanon. Tapos sabi ko, ouch. Pag yung ganyan, ayun, naramdaman ko na. Tapos November 14 yun. November 2014. Tapos nagpa-test ako November 2016. Sa pilitan pa. So all those times, wala talaga akong ginawa. Inignore ko siya. Sabi nga ng doktor ko, mahal daw ako ng Diyos. Kasi kung normal lang yan, normal na yan na meron ka ng nakapa, may tumor ka na, usually lumalaki yan eh. Kasi that's how it grows, di ba, yung cancer. Pero nanahimik siya doon. Tapos, perfect timing. I think yung sa akin, swerte, mahal talaga ako ng Diyos, sinwerte ako. Pero, ang pinupush ko ngayon, do your self-check. Madaling mag-self-check kung sa breast yun at saka sa kilikili, habang naliligo ka o habang nakahiga ka sa kama, kapain mo lang. Pag may nakapa ka na parang hindi normal, magpa-check up ka. Also, pag tumayo ka lang sa harap ng salamin, taas mo lang yung kamay mo na ganyan. Pag may nakita ka ng na anong tawag ng Ate Ana, yung parang may dimple o
yes, there's something abnormal sa breast. Pa-check mo na.
Pa-check mo na. Pag may discharge, pa-check mo na. Please, huwag kayong maghintay. Kasi mas madaling gamutin ang breast cancer pag maaga.
Pag early. Tell us, Emily, about your annual check-up after 2 years na dun namin nakita. So dumanan 2 years and then finally nagpa-annual check-up at pinsan ko.
Nagpa-annual check-up ako kasi kailangan. Sa trabaho, mandatory yun eh. Pero wala kaming breast exam. So nung sinabi ng doktor, over 40 na ako, magpa-mammogram ako, ayoko. Kasi sabi ng marami, masakit ang mammogram. So ayoko talaga magpa-mammogram. So sabi niya, sige, pa-ultrasound na lang tayo. So nagpa-ultrasound ako. Yun na nga, nakita nila agad-agad Tapos, nakita rin nila yung nasa kilikili. Kaya, mabilis na pagkatapos nun, alam na kagad nila cancer. Kasi the way it looks like, tapos nung binayopsy ako, yun na, totoo nga, meron na akong cancer. So parang November 5 ata yung annual physical exam ko. November 9 ako binayopsy. November 15 or 16 lumabas yung results. Tapos yun, pagkatapos nun, nagulo na yung mundo ko. Yun na.
Oh my gosh. Oo.
Mm-mm.
Thank you, Emily, for sharing that. Let's go to Tita Purit muna. Tita, who told you na
Yes.
what happened to Emily? Ikaw ba ang unang sinabihan? And how did you feel nung nalaman mo? Oo.
Actually, hindi niya sa akin sinabi agad. Wala pa siyang sinabi. Basta,
Okay,
she
kanino?
just said
Oo.
na, I think kay Jamie, sa sister niya. Dahil siguro
Okay.
alam niya, you know.
Of
Pero
course,
later
mahirap
on,
din.
sinabi lang niya,
Tapat, opo.
yung sinabi niya lang sa akin una, na she was done an ultrasound, and then they found out that there is a mass that looks like a suspicious mass, okay? So she called me up, that's what her news was. But sabi ko, oh, don't worry, suspicious lang pala yan. Sabi ko, we have to be sure what it is. At that time, when she told me about it, through phone, sa telephone lang, I was in church. Nag-aayos kami ng mga bulaklak na cleaning the room, na adoration room. Tapos after I learned about it, sabi ko, dasal ako kagad. First of all, I tell everyone, faith in God talaga. You should be praying and praying. Talagang prayers ang importante. So yon, instead of mag-nervous ako, mag-panic ako, I made myself calm para noon kung hindi ako magkakalma, mas lalo pa ako makakakalagdag sa So anyways, so yon, after that, sabi, ibabiopsy pa. Yun na nga, sabi ko kanina, we want a second opinion. That is why I thought about Dr. Norman, who was here at that time. And in spite na alam ko napaka-busy niya because he is in the process of moving here. Pero sabi ko, importante to, I have to disturb him kahit papano. And then, so I called him up and I asked Emily first if she wants to have a second opinion done. Of course, sabi niya ganon. Dr. Norman, cousin mo. Kasi we have not seen him for a long time, actually. And then, sabi niya ganon, you want to say, let us go to him and, parang
Pa-check.
Iba yung laman mo, doktora eh. Iba yung kamag-anak mo, iba yung
yes,
kilala mong
definitely
personal.
naman. Opo.
Oo, hindi lang yung, actually, there are many good doctors. Pero siyempre, first time lang nakita yon, So yun ang important. And to my surprise, agree kagad si Emily kasi alam mo naman, pag mga ganyan na mga edad ng mga anak mo, they make their own decisions. But she agreed. So we went to him. So nag-usap, chinek up niya lahat. So, pero wala pang biopsy results, so magbabiopsy pa lang. And he was about to go back to the States at that time. So sabi ko, anyway, ang importante, nakausap namin siya and he explained everything. Lahat explain niya at saka kung ano ang kailangan. But he has to know the results first before doing anything else. So yun, we waited until yun nga, nagkaroon na ng biopsy and the result was malignant. And parang, yung malignant, parang...
Anong naramdaman niyo, tita, nung narinig yung malignant?
My God, sabi ko, sabi ko,
lalo na tang bata-bata pa po ni Emily.
Oo, sabi ko, Lord, tulungan mo po kami. Sabi ko, alam mo naman kung anong yun, basta I prayed kasi wala naman ako ibang magagawa kundi humingi ng tulong sa Diyos. Yun ang aking And I think he heard all our prayers and answered them together with Mama Mary. Wala namang iba eh. Yan, I'm very thankful. May mga doktor, may mga ano. Pero, alam mo, basta, I just kept myself
Ate Ana,
calm.
may I add, Ate
Masyadong
Ana?
emotional pa rin si tita after all
Oo.
this time. Kasi syempre, daughter niya yun eh. Iba talaga. Thank you, tita, for sharing. Ikaw, Emily, let
Okay.
us know, how did you move towards surgery and how did you feel telling your mom?
Ate Ana, when I was diagnosed, pinaka-worry ko si Mama. So, sabi ko, I don't want to break her heart. Para akong failure. Yun yung naramdaman ko
Bakit
kasi.
naman? Oo.
It's
Kasi
not your fault to have that.
Yeah, I know. But I felt, oh my God, I'm going to break her heart. Yun yung naramdaman ko. And the least thing you want to do is break the heart of your parents, especially your mother, di ba? So sabi ko, tas tumawag siya sa akin. Alam ko na yung result. Tapos sabi niya, you're going to tell me, right? You're going to tell me because you cannot hide this from me. Wag mo akong tataguan. Wag mong itatago. So sabi ko, what if what if I have cancer? I can still hear our conversation. Tapos sabi niya, then we'll have it fixed. But you have to tell me. Tapos sabi ko, okay. So, hindi ko pa rin sinabi sa kanya. Tinawagan ko muna yung kuya ko sa Amerika. Because he's the one who's not here. And he's the one whom I think is solid and won't be emotional. So, I told him, I have cancer. So, yun. Tapos pagkatapos nun, sinabi ko na kay mama. Sabi ko, mama, I have cancer. Tapos sabi niya, nag-pause siya. Tapos sabi niya, okay, we'll have it fixed. Yun lang sinabi niya, we will have it fixed. Tapos, pagkatapos nun, ano na nangyari? Marami ng emotion. Kasama ko yung sister ko sa hospital. So, nung umiyak na rin siya. Alala ko, nung una kong sinabi sa kanyang merong suspicious mass, she was at her office. Her office was near Medical City. So, so ang pag-describe niya sa akin, ay tumayo daw siya. Tapos sabi niya, I have to go. Tapos ang ginawa lang daw niya talagang tinabi niya lahat ng gamit niya. Tapos sabi niya, I have to go. So she left in the middle of her work and then she rushed to go to me, to be with me. Kasi I was already broken. So yun yung kaya pag sinasabi ko yun, parang oo, gusto kong nahiya akong umiyak kasi I don't want to cry. But it was a very, for anybody
Huwag
who's
ka tayo
going
mag-cry
through this.
kasi baka maano yung mga
Hindi, tears of happiness to. Sabi ko nga kanina,
maraming
diba?
kwentong magaganda, doktora.
Oo,
Just listen.
sabi ko kanina,
napakarami.
allow yourself to be emotional. Importante yon. Kasi pag hindi mo naramdaman yung lungkot,
You just have to
hindi mo
bring it
naramdaman
out,
yun.
you know?
Oo, parang lalo kang mahihirapan mag-release. Tapos sabi nga nila, part of the reason why you have cancer is all your hidden emotions, frustration, stress. So kung hindi mo ilalabas, allow yourself to cry because it's okay. Tapos pagkatapos noon, pagbangon, chin up, chest out, tapos lakad, laban. Yun yung gagawin.
I forgot to tell you, doktora, Emily is the strongest person I know, you know. Napaka-strong, sabi ko nga, since birth, malakas na yan eh. She's very strong and very, brave, matapang. She has 3
Malakas
sons.
ang loob, opo.
She has 3 sons, single parent siya. Siya lang
Single parent
everything.
pa, oo.
Oo. Yun lang ang yun lang ang naisip ko rin, paano yung mga bata. Pero actually, hindi ko inisip masyado yun. Ang inisip ko lang, magagamot natin, we will fix it, and it will be fixed. Yun ang faith ko, gagaling. God will never let something happen na hindi makakabuti sa iyo. Yun ang yun ang paniwala ko. At saka, after that, kwento na natin yung magagandang events, Emily.
Madami.
Yes.
Naiiyak
na
na
natin muna
After,
kay Ate Ana.
let's move towards your surgery, Emily. Paano mo naramdaman, how did you go through, sinong kasama mo during the operation, who was with you in the hospital?
So,
Ano mo?
So nakakatawa yung ano namin kasi si Dr. Norman walang hospital, hindi siya accredited, affiliated dito sa Pilipinas.
Yes.
So kailangan
Ay, wait.
namin maghanap
Affiliated.
Si Dr. Norman is Dr. Norman San Agustin.
San
Yes.
Agustin,
Yes.
yes.
Our first
Oo.
cousin, yes. And
Oo.
a US-based breast surgeon. Okay.
So siya, so nung
Sige,
dumating
Emily,
siya,
kwento.
nung dumating siya, sabi niya, maghahanap tayo ng hospital kung saan ako pwedeng mag-surgery, ako iaalaw ako kasi yun pala hindi basta-basta pinapagawa yun Ate Ana.
Yes,
Kailangan
you cannot.
Oo, you
Oo.
cannot. So yun pa lang, medyo may challenge na. So nung Sabado linggo ng gabi, sabi ni Dr. Norman, or I think it was his secretary, operahan na ako ng Tuesday. So walang preparation. Tapos yung Tuesday, birthday ng anak ko. So may party kami, may bowling lahat-lahat. Also, birthday din ni Dr. Norman San Agustin. February 14 yun, Ate Ana, Valentine's Day. Nung Valentine's Day, so dumating ako sa hospital, dala ko yung gamit ko. Parang naguguluhan pa ako kasi ang bilis-bilis. Tapos, so siguro dahil he's a US surgeon, tapos si Dr. Sam yung nandun, tapos si Dr. Brian Ang nandun din. Parang it's a strong team. Tapos parang naging event siya sa Cardinal.
Tell her
Na
about the
ang dami-
anesthesiologist.
Ang daming interns. Parang nung Valentine's na yon, sorry nakakatawa. Parang yun yung pinaka araw ng Valentine's na ang daming lalaking nakatingin sa boobs ko. Tapos yun din yung time na parang ang daming humawak. Sabi ko, ito ba yung mga Valentine's date ko? Parang ang gulo-gulo. Baski yung anesthesiologist natataranta siya.
Oo,
Kasi we haven't met.
Ng pasyente.
I forgot. She doesn't know my name. Kasi tinawag na lang siya. Basta magulo. Pero, it was, despite all the chaos, very organized siya. So, nag-start kami mag-prep ng 8 o'clock ng umaga or 8 o'clock, i-measure yung saan magsa-surgery, mag-uusap-usap yung mga doctor, anesthesiologist. Tapos nag-start ata yung surgery ko ng 3 p.m. ba, Mama? 3 or 2 p.m.?
No. It ended 3 p.m. It started earlier. Matagal ka sinergy.
Tapos 3 p.m. Tapos nagstay ako sa recovery room. Umalis ako doon ng 8 p.m. Tapos nung 8 p.m. Nung nandun ako sa operating room, yung pinaka maganda doon, kilala ko yung doctor ko. Kilala ko rin, trusted din yung ibang doctor. So nung i-anesthesia na ako, sabi sa akin ni Dr. Norman, dapat nakabakasyon ka ngayon, 'di ba? Saan ka pupunta? Sabi ko, pupunta ako ng Malaysia. O sige, think Malaysia. Tapos pagkatapos nun, wala na akong naisip. Pagising ko, tapos na. Tapos nung pagising ko, tapos wala akong naramdaman, everybody. It was done. Tapos nung dinala na ulit ako sa kwarto, para lang akong bagong panganak, yun yung pakiramdam ko. Kasi
Tapos
may
gusto ni
surgery.
Dr. Norman, umuwi ka na kagad eh.
Oo. So hindi ako nag-stay
Sabi
sa
niya,
hospital. Pagka-uwi,
wag mo na yung patulugin dyan, uwi mo na, sabi niya.
Oo. 11 o'clock ng umaga, umuwi na ako. Sa bahay na ako meron pa akong kasi so ang ginawa sa akin, partial mastectomy. Yung una dapat gagawin sa akin nung una kong doktor, full mastectomy with reconstruction. So, yun yung tatanggalin yung buong boobs mo. Tapos, lalagyan ng, anong tawag doon? Parang plastic surgery, lalagyan ka ng boobs para So, yun dapat. Pero nung tinignan niya, maliit lang, hindi kailangan. So, nag-breast preservation kami. Medyo may maliit na uka yung boobs mo, pero buo pa rin siya. So parang hindi pa rin bawas yung pagkababae mo. Kasi usually daw pag dito sa Pilipinas, immediately pag may breast cancer, diretso agad na mastectomy.
Yeah, mastectomy.
Actually, ako nung bago ako na-diagnose, sabi ko pakitanggal na lahat. Yung parehong boobs. Yung healthy at saka
Angelina
yung
Jolie
may
na.
sakit. Parang sabi ko,
Mm.
parang tapos na, para walang problema, tanggalin na lahat. Kasi yun yung orientation natin
Yung
dito sa
mindset mo.
Philippines. So ano na lang. So, buti na lang, I didn't do it. Kasi pwede naman pala yung option na partial mastectomy. Para lang siyang lumpectomy na medyo mas malaki. Pero, buo pa rin yung boobs mo. So pwede. Kasi sabi naman, in-explain din naman ng unang doktor ko, whether you do lumpectomy, partial mastectomy, or full mastectomy, walang difference yung effect. Yun lang.
The survival is the same.
The survival is the same. So, kung meron kang option to save your breast, why will you not save
Why
it?
not? Oo.
Oo, why not? So, pero kung malaki na yung tumor mo, syempre, ibang usapan na yon. Kaya nga, pag maaga mo na-detect, maaga mong mapapagaling, pwede kang mag-preserve ng breast mo. Life goes on. So, yun.
That is a good story. Oo. Tita Purit, so
Yes.
after that, nag-chemo ka na. Can you tell us some, paano kayo nakakuha ng lakas during chemo? Kasi di ba parang scary time yon. Ayan, magkwentuhan naman kayo ng medyo nakakatuwa. Baka naman
Actually,
you
I
want to show
remember-
your pictures, Emily. Dito lang kami, ha?
Nandyan yung pictures ko kay Kathleen.
Kath, okay.
So-
We'll ask her to get ready. Magkwento ka muna.
Oo, so sabi kasi, so chemo, iniyakan ko yung chemo. Kasi nung nabasa ko sa Google, sabi yung chemo, mahirap. Magsusuka ka, mahilo ka, manghihina ka, mangangayat ka, hindi ka makakain. Basta lahat ng pangit mangyayari sa chemo. So parang ako, sabi ko, ayoko mag-chemo.
I remember.
Sinabi ko rin sa mama ko yun.
Talagang
sinabi ko sa
umayaw ka
mama ko,
muna. Oo.
Ayoko mag-chemo. Tapos sinabi ni Dr. Norman, sinabi ko kay Dr. Norman, ayoko mag-chemo. So si Dr. Norman, kinausap niya si mama. Sinabi niya, nagkapampangan sila na hindi ko naintindihan. Pero ang message was, kailangan niya mag-chemo kung gusto pa natin siyang mabuhay at least 40 years. So you talk
Hindi,
to her.
ang sabi niya sa akin, Emily, sabi ko, Doc Norman, sabi ko, nakikiusap kami, baka pwedeng iwasan ng chemo, sabi ko gano'n. But they already talk about it, siguro yung extent kung anong kailangan. Sabi niya gano'n, gusto mo bang humaba ang buhay ng anak mo? Sabi niya sa akin gano'n. Of course, then chemo tayo. Sabi niya gano'n. Yun lang.
Ayan.
So chemo.
So ate Ana,
my faith in him is so strong also.
Sabi nung unang meeting, 8 chemo sessions. Tapos naging 16. So sabi ko, teka, ang dami na nun, ang dami na. So I told my best friends, magkikimo ako, nag-cancer ako, mag-chemo ako. So anong gagawin namin? So sila yung sila yung parang entourage ko, cheering committee. Support, the best. So ginawa namin. So 16 sessions. 16 sessions of chemo. Sabi nila, cancer is a journey. 'Di ba? So sabi ko, journey pala yung cancer. So mag-journey tayo, literal. So spinel ko yung chemotherapy is fun. So chemotherapy apostrophe is fun. 16 letters lumabas. So bawat letter, ginawa namin ng costume per country. So C, China, H, Hawaii, Egypt, M, ano ba yung ginawa namin sa? Basta, makikita nyo yung pictures.
Basta iba-iba. Oo.
Iba-iba. So, Ate Ana, nawala yung isip ko sa chemo. Kasi worried ako sa costume. Pati lahat sila worried sa costume. Kung ano yung costume namin. Si Mama, inaabot ng 2:00 ng umaga. Nananahi siya ng costume.
Nagtatahi ako ng costume.
Tingnan natin yung pictures mo, Emily. They're here. You wanna tell us about them?
Sure. So,
yan. Let's show the pictures. Yan. So, parang lumakas yung loob mo na, ayan, at least you were thinking of something else. Ayan.
Yan yung graduation ko. So, nag-graduation kami. So, nagsuot ako ng toga. Pati yung mga friends ko. Tapos yan yung
that's the last chemo actually. Oo.
Yeah, that's my last chemo.
Okay.
Yan yung kami. Nag-rent pa kami ng toga.
Wow.
Tapos,
Okay.
ito yung mga anak ko, yan yung tumutubo na yung buhok ko.
Yes.
Yan na siya, yung
Speaking of
itsura
the
niya.
buhok, Doktora, I want to share a story of the buhok. So after
Sige.
second chemo lang ata, it started falling
Third.
already. Tapos,
Oo.
sabi niya, and then later on, sabi niya, patatanggal ko na ang buhok ko. Sabi niya nun. So, alam mo, hindi kami umiiyak nung ibang araw. Pati yung hairstylist niya umiiyak kasi nga isi-shave na. Sabi ko, it's okay, ma. Parang kontra pa ako ng kontra. Hindi, wag mong pa-shave ganon. Tapos hindi, kasi hindi mo nakikita, nalalaglag ganon. Anyway, so in short, na shave. Tapos, so nag-turban, sombrero because she has to. I think you were working back already, Emily.
I was working. I was working.
Nag-work ka
Ate
na,
Ana,
Emily.
habang nagkikimo ako,
Habang
nagtrabaho ako.
nagkikimo,
So,
nag-work siya. Tapos,
so
Ayan.
alam
hindi
mo,
siya,
pati yung pag, ng wig, in-advise ni Dr. Norman, sabi niya kung gusto niyang mag-wig, you can get the wig from here and there. Sabi niya ganon, ma, I think I have to get a wig, sabi niya. So, yung custom-made na wig talagang isusukat sa'yo. Anyway, so,
Ay,
she
parang
looked
ito
better
po yung
with it.
naka-turban ata itong picture na to. Tingnan natin uli.
Hindi, naka-costume
Ito
kami
yan.
niyan.
Costume.
Sige, tingnan natin.
So, costume pa rin yan, Rwanda. Hirap pala kami maisip na country na letter R.
Okay. All right.
So, sa chemotherapy, yan yung R, yung R.
Okay. Ayan.
Yan, graduation nilet yan, may medal ako kasi nanalo
Doktora
ako ng
Para.
life.
He's also very
Si
good
Dr.
doctor.
Joseph Para. Oo.
Okay. Ayan,
Yan kami.
graduation.
Graduation na yan, graduation.
Ayan na, kita mo. Ito yung costume namin na
Ano po?
Mga workers. Ano ba yung uniform. Letter U sa fun. Uniform. So yung uniform ko sa hypermart ng SM, yung kaibigan ko sa McDonald's, si Mama sa SM yung supervisor.
Saan niyo nakuha yan, ha? Okay yan.
Di ba? Isipin mo. Mother butler yan ni Mama, pero ginawa namin uniform na para.
Mukha nga kayong SM. Okay, this is Japan ba to?
Japan. This is Tokyo. Oo, kasi walang J.
Tokyo. Okay, very
Tokyo,
good.
yan.
Friends niya yan, mga
yung
classmates niya in high school.
Rwanda pa rin to. Saan pa ba yung iba? Ito, Egypt. Ayan. Tingnan mo yung costume ko. Nagkikimo ako sa hospital sa Makati Med. Yan ang suot ko. Hindi ako.
Okay lang yan.
Tuwan-tuwa rin sila
sa bahay. Hindi yan kuha sa bahay. Sa hospital ako. Sa hospital yan. Kung ano yung suot ko sa hospital, the whole time, guguluhin namin yung cancer center. Tapos, syempre, it also, I think, brought some smiles to the other patients.
Patients. Tama naman.
Oo. Kasi usually, pagpunta mo doon, yung mga...
gloomy ang dating
Yung mga patients, naka-pajama, naka-sombrero, naka-bini, naka-wheelchair. Dumating kami, naka-high heels, naka-makeup, naka-costume.
Ano nga yan? Texas yata yan, ano? Texas yan,
Texas. Yep.
Yeah. Mga cowboys.
Okay.
Ayan,
Hollywood.
Hollywood.
Bata sexy naman ito.
Yan, kaibigan ko yan.
Very nice. Ayan, may mga Audrey Hepburn pa. Oo.
Ayan, si Kim Kardashian.
Okay.
Yan, ganyan kami pumunta sa hospital. Ate Ana, it's very important. Pag nagtitreat, I want to tell a story about this relic. I want to tell a story.
Yung relic?
Yeah, in one of my chemo sessions was the celebration of the 100th year apparition of Our Lady of Fatima. So doon kinanonay si Saint Francisco at saka si Santa Jacinta. So in my prayer on Sunday night, kasi Monday morning yung chemo ko, I was talking to Mother Mary. Sabi ko, Mama Mary, it's time. Naka 100 years ka na. from your last operation. Baka naman pwedeng mag-appear ka na ulit. Mag-apparition ka na ulit. That was my prayer. And then in the morning, at the Makati Medical Center, Cancer Center, magsa-start na kami ng chemo. May nagpi-page sa akin sa labas, Miss Emily Bais, Miss Emily Bais. Tapos sabi ko, I'm here. Tapos sabi niya, mayroon po kayong bisita. Tapos pinasok nila yan. Winir nila sa loob yung relic ni Santa Jacinta at saka ni Saint Francisco. Na sabi ko, oh my God, hindi nag-appear si Mama Mary, pero pinadala niya yung dalawang nakakita sa kanya 100 years ago. So,
Wow.
sabi ko, wow, now more than ever, I believe you can hear me. Kasi, how? Wala naman akong, tapos Ate Ana, yung nag-wheel in sa kanya, yung doctor ni Luis, nung pinanganak ko siya na premature na 6 months.
Pedya.
The premature.
Oo, siya yung nagdala sa loob. So apparently, meron kaming common friend na alam nandun ako, pinadala siya. They didn't tell me, but they worked through my angels to bring this message from Mama Mary. It's not yet time for me to visit you, but here are the kids. Here are the kids who were canonized, who saw me last, and they're gonna visit you for me. So, isn't that amazing? It's just very amazing. Yes. Oo. So dun sa
sabi
mga...
ko, dali dun sa mga ibang... Di ba, Emily, remember, sabi ko sana dalhin dun sa ibang nagkikibo rin so that they'll also see it.
Yep.
Praise God. Ang bait ng Mama Mary.
Yan yung mga
galing. Ayan. More happy pics. Ayan.
Marami. So sabi ko nga, you have to choose your battle. You have to choose your emotions. Doon ka ba sa masaya o doon ka sa malungkot? 'Di ba mas maganda yung may sakit ka na nga tapos malungkot ka pa, parang nakaka-depress na 'yon. So, ayan yung nawala yung hair ko. Yan yung araw na nagpa-shave ako.
Yan ang iyakan blues namin.
So, Ate Ana, ang advice ko, kilay is life. Nagpakilay ako bago ako nag-chemo. Kasi importante na when you look at yourself sa mirror, makikilala mo pa rin yung sarili mo. Kasi yung chemo, iibahin yung itsura mo. Mawawalan ka ng buhok. Mamamaga yung mukha mo. So, hahanapin mo talaga yung sarili mo na parang you start not to recognize yourself anymore because of the effect of the medicine. So, how do you fight that and stay as who you are physically? It's also important. Hindi lang yan about emotions. Hindi lang yan mental battle. Siyempre, kailangan pagharap mo sa salamin, kilala mo pa rin kung sino ka, maski nakalbo ka. So, yun yung, that's why nung sinabi ko una, importante, educate yourself. Alamin mo lahat ng mangyayari sa'yo para walang gulatan. Prepared ka. Medyo siguro mahirap lang i-prepare yung emotions kasi talagang very real siya, very raw, hilaw na hilaw. So, kailangan at least yung mga ibang bagay mentally ready ka na. Importante yun.
Yan. Emily, thank you for sharing. Tita Purit, thank you for sharing. Emily, we know you as a cancer advocate. Can you tell us what you're doing naman?
So, yung pinapromote ko kasi nga from my own learning, naghintay ako ng 2 years. Mahal lang ako ng Diyos. Sobra. That I was able, despite na dinelay ko yung treatment ko, yung pa-check up ko, I am here in front of you talking about breast cancer and how you can avoid it or have it treated. Importante, self-check. Pag at least, kung may history kayo ng cancer sa pamilya nyo, breast cancer, kahit anong cancer, mas maaga, mas mabuti magpa-check. Ang sabi nga ngayon, 30 years old, dapat nagpapamammogram ka na kung meron kayong history ng cancer.
If you have a strong family history, yes.
Yes, strong family history. Kung ayaw nyo naman ng mammogram, meron namang ultrasound. Less invasive. So correct lang natin yung thinking about mammogram.
Motion.
Oo. Ano siya? Uncomfortable. More than painful. So, ang secret ko, tuwing nagpapamammogram ako, naka-high heels ako. Kasi,
Para mas
Mahirap
masakit yung paa mo. Kesa sa boobs.
Hindi kasi na-notice ko, parang palagi akong tumiting kaya, nakasubsob ako doon. Pero pag naka-high heels ako, komportable lang siya. So tip ko yan that's my personal experience. Tapos, relax. Pag magpapamammogram, relax. Kasi mas, nakaka-anxious. Mas
Tense
nakaka-nervyos.
ka na, tapos
Tense
ano
ka
pa.
na, tapos,
Oo.
at saka,
Nandun ka pa, oo.
nandun ka pa, patong-patong na yung nararamdaman mo. Tapos yung mammogram, syempre, kung meron ka nang nafe-feel, tapos kailangan mo pa mammogram, mas mabuti, di ba, na alam mo? It's better to
Oh,
know
definitely.
than not to know may sakit ka pala. Bigla na lang sasabog yan. So, ang ina-advocate ko talaga is early detection because it can save
Yes.
lives. Sabi nga
Yes,
ng
secure.
doktor ko, Dr. Norman San Agustin,
Of Asian Breast Center.
of Asian Breast Center, if you detect it early, it's curable. Curable siya. Also, kailangan, tama yung doktor mo. Nakita ko may nagtanong, ano bang klaseng doktor ang dapat puntahan? Iba-ibang doktor ng cancer ha. Step by step yan. Yung first mo, yung kung magkakaroon, ang una ko is my surgical oncologist. Siya si Dr. Norman San Agustin. Siya yung magpe-prepare ng magtanggal ng cancer mo, surgery mo, ganyan. Pero hindi siya yung magagamot sa'yo unless, Ate Ana, may doktor na gano'n na all around para sa cancer. So, ang sumalo sa akin, pagkatapos, medical oncologist naman. Yung medical oncologist, siya yung magpe-prepare ng chemo treatment mo, anong gamot, anong dosage, gaano katagal, anong klase, ano yung maintenance mo. Siya yung tungkol sa gamot, siya lahat yon. Hindi yon yung surgical onco. Kasi Ate Ana,
Medical.
meron na akong marinig na mga kwento. Nagstay lang sa surgical onco kung ano-ano yung gamot na binigay kasi hindi naman niya alam. So pagkatapos ng medical oncologist mo, kung kailangan mo mag-radiation, ibang doktor pa
There's
rin
a
yun.
radiation oncologist. Yes.
Oo, there's a radiation oncologist. Pag natapos mo na lahat yung graduate ka, balik ka sa surgical onco mo. Doon ka
Papa-check
monitoring,
up.
siya yung papa-check up, siya na lahat yung titingin sa'yo kung meron bang progress or stable na lahat, siya lahat yon. Maliban doon, kailangan monitoring. Pag nagkaroon ka na ng cancer, pagkatapos mo mag-treatment, it doesn't stop there. Kailangan mo nang magpa-check up regularly. Unang taon, every 3 months. 3 months na CT scan, blood test. Tapos, pangalawang taon, every 6 months. Mammogram alternate at saka CT scan. CT scan every 6 months, mammogram. Tapos on the 3rd or 4th year, once a year na lang graduate ka na. So, once a year ka mag-mammogram, once a year ka mag-CT scan. So, magiging katulad sa akin, February mammogram, August CT scan para merong monitoring in between
So you
the
have to
mammogram.
monitor with mammogram. Huwag mong
Monitor,
pabayaan. Yes.
Huwag mong pabayaan, masanay ka na. Kaya tiisin mo yung ilang minuto lang naman yung mammogram eh.
Kaya niyong tiisin yan.
Oo, yung actual na pag-press, seconds lang, hindi minutes. So gusto mo nang tiisin yun kesa naman magkasakit ka tapos magkikimo ka, lahat. Kasi pwede
Matagal yun. Okay.
Matagal. Di ba, Ate Ana, ngayon, pag early detection, pwedeng hindi ka na
Yes.
mag-chemo. Surgery
There's
lang, saka
even like that.
radiation.
Opo. There's even
Pwede
like
na
that.
yun. Kaya, kung patatagalin nyo yan, di lalo kayong magkakaroon ng problema.
So don't be afraid. Pa-check
Don't
up.
be afraid. Wag
Yes.
wag matakot. Matakot magkasakit. Wag matakot magpa-check.
True. Parang may nag-share ata dito sa ating next comment. Ayan.
Miss Arlene Esquivel. Good afternoon po. Praise be Jesus and Mary. My mother po was diagnosed with breast cancer stage 3C. Was operated at nag-undergo po ng chemotherapy and radiation. With God's grace, she survived the big C. Malaking tulong ang support group and maging positive lang po talaga at have faith to God.
Ang
Yes,
ganda.
Yes. Very good.
Appear
Yes.
kami, pareho kaming stage
Sure.
3C.
3C ka ba, Emily? I'm glad you are over
Oo.
it.
'Di
Yes.
ba? 3C.
Yes. Next po, meron pa?
From Miss
Okay,
Liz
tinanong na ata
Sousa,
yan.
anong klaseng doktor po ang dapat
Tinanong na
puntahan?
yan. Yes.
Okay.
Pag na-feel na lump sa breast. Well, at eto ako sasagot ha. Kung may nakapapo kayo, the first thing to do is to see most likely a surgeon. Kasi yun po talaga yung mag-order po ng mammogram. If you are younger, then you need an ultrasound and a mammogram. But definitely po, you need to see someone about this. Wag niyo pong pabayaan. Wag niyo gayahin yung pinsan ko na 2 taon. Okay, don't.
Oo, wag niyo akong tularan pagdating doon. Wag na wag.
Don't follow her. Okay? Don't
From Miss
follow her.
Olette,
Immediately get a checkup. Ayan.
from Miss Olette Torcula Silva, hi Miss Emily Aliwalas Bais. Happy for you.
Si
Wow.
Olet, fellow cancer survivor yan. Assumptionista rin siya. Hi, Olet! Idol ko yan. Tinulungan niya rin ako
Okay.
tinulungan niya rin ako during my cancer journey. Humingi ako sa kanya ng mga tips. Hi, Olet! Thank you.
Thank you so much, Emily. Thank you so much, Tita Purit. So,
Thank you.
closing statements na po tayo. Tita Purit, what would you advise sa mga mommies po na may anak na may breast cancer para lumakas din ang loob ng mga nanay? Kasi baka sila yung bumigay. Syempre, anak nila yun.
Yes. First of all, have faith in God. Be prayerful. It's a big tulong yan. Pag nagdadasal ka. It makes it makes you stronger. Tapos yung support, wag mong pakitang sa anak mo na takot ka rin. Kasi lalo siyang, manghihina ang loob. We should all be
Be
strong.
strong.
Yes. Pakita mo na kaya natin to. And then, yung good doctors, yung tamang doktor, kung alam yung anong gagawin, tsaka yung you should cooperate with everything that your doctor says kasi they know best. At tsaka support ng family, support ng friends, and yung mismong pasyente should be positive, lahat positive. Lagi mong isipin, gagaling ka. Don't be, yung like what we did, parang walang chemotherapy, parang hindi ka feeling sick, That's one good example. Positivity, importante. Ang goal natin, gumaling with prayers, with good doctors, with good support, and positive thinking, nagagaling ka. I think
That's it.
that's about
Makakayanan
it.
din po. Ano po.
Oo, kaya mo yan. Always say, kaya natin to. Basta, huwag mawawala ng hope. Hope and
Ayan.
faith in God. Ako, yan ang
Ayan.
hinawakan
Thank you,
ko
Tita.
Yes, sure.
Yes. Hope, stay strong, faith in God. Ayan. Emily, last words para lumakas ang loob ng mga natatakot who are undergoing this journey ngayon.
Nakakatakot naman talaga, pero you have to be positive about it. Pumili ka ng tamang emotion. So sabi ko nga kanina, pipili ka lang naman, always dalawa lang yung pagpipilian mo. Malulungkot ka ba, matutuwa ka? Matuwa ka kasi pagdadaanan mo na yung treatment, ibig sabihin nun gagaling ka na. Pag nalaman mo may cancer ka, ibig sabihin alam mo na may sakit ka, mayroon ka ng way para gumaling. So matuwa ka. Educate yourself, importante 'yon. Alamin mo kung anong pinagdadaanan mo. Kung hindi ka sigurado sa mga sinasabi ng doktor mo, magtanong ka. Very important. When you're in
Always
doubt,
ask.
pag hindi ka sure, huwag ka lang tanggap ng tanggap. Magtanong ka ng questions. Isulat mo lahat ng tanong mo. Ito yung time na medyo nakakapanik. Yung chemo, nakakatakot, pero yung nag-chemo ako, hindi ako nagsuka, hindi ako nahilo, hindi ako nanghina, hindi ako nangayayat. Kasi yung doktor ko, tama yung mga dosage niya, meron siyang pangontra ng suka. Kaya alamin niyo kung ano yung options na pwede sa inyo para hindi kayo manghihina habang nagkikimo kayo. Kumain ng tama. Nutrition is important, magpahinga. Kung kaya nyong itigil mo na yung trabaho or bawasan yung trabaho. Kasi you need to dedicate 100% to your healing. Ito yung mga times na na-realize ko, dapat pinarioritize ko yung sarili ko. Kasi usually, pag nasa edad na tayo, tapos may mga tayong inaalagaan, usually yung sarili natin yung last. So now prioritize yourself, love yourself, and then last but not the least, keep a
Take
strong
care of
faith.
yourself.
Keep a strong faith. Importante yung meron kang pinaniniwalaan because at the end of the day, it's your faith that will help you, that will get you through this, that will calm you. I always pray to God to silence my fears and take it away. Take them away. And He does. Also, balikan ko lang yung tungkol sa buhok. Pag nakalbo ka, ito yung sasabihin mo. For every hair that falls is a cancer cell that dies. So, hayaan mo na ang makalbo. Kasi ibig sabihin nun, nawawala na si cancer. Yun yung importante doon. But lastly, please, for those who are scared to have themselves checked, buuin nyo yung loob nyo. Importante. Be courageous. Masakit lang yung mammogram ng, actually hindi siya masakit.
Actually, hindi
Uncomfortable siya.
masakit.
Uncomfortable siya. Pero, seconds lang siya. Seconds, tapos na. So, that can save your life. Whether they find something or not, it can save your life. Or it can save the lives of your loved ones. So, kung meron kayong kapatid na babae, nanay, girlfriend, asawa, anak, please, that's one way to show you love them, is to take care of them and encourage them to do self-test. Marami nang nagkakasakit. Wala na siyang pinipiling edad, Ate Ana. Mga bata, dati ang cancer pang 60 years old and above. Pero ngayon, as early as below 20 years old, meron ng cases.
Meron nang
Actually,
nagkakasakit.
meron na rin mga lalaki nagkaka-breast cancer. So, hindi na lang to
So
exclusive
have
para sa
yourself
older
checked.
women.
Yeah.
Yes. Please have yourself checked. Kung takot kayong pumunta sa hospital, merong Asian Breast Center na very secured para hindi kayo nakahalubilo sa mga ibang pasyente. Pwede kayo through Ate Ana, pwede rin sa Facebook ko. Meron din Asian Breast Center na Facebook. Connect with us and then we will get you set up. Pero important, please, love your family, get yourselves checked. Thank you, Ate Ana. Thank you so much
Thank
for
you,
this opportunity.
my
Thank you,
pinsan. Ang ganda ng
Dr.
pinsan ko. And my
Aywani.
tita. Thank you so
Doctora,
much.
thank you.
Thank you so much. Ang ganda ng kwento nila, no, Reina? I hope you liked it. They're a mother and daughter team. They're my tita and my pinsan.
Super na-inspire ako, Doc. Ay,
Yes,
nako, na-inspire ako. Because I
Yes.
remember crying to you. Do you remember that, Doktora?
Oo
When
nga,
I was-
natakot ka rin. But thank God,
Yes.
hindi naman yun nangyari. Yes.
Yes. Yeah. So,
To everyone, ang ganda ng sharing. Thanks, Rains. Thank you to my pinsan, Emily. Thank you for my tita, Tita Purit. I think their message is one of hope and love. When someone that you love gets diagnosed with breast cancer, you have to support them. We will support them. We will be there for them. Wag po silang matakot. Faith in the Lord is number one. But again, sabi nga po nila, we also have to do our part. Kailangan po tayo magpa-check up because a mammogram can save your life. So maraming salamat po. October is Breast Cancer Month. I-just re-review ko lang po. We had a talk on breast surgery or the surgical treatment of breast cancer. We have a talk po on mammogram at bakit kailangan pong magpa-check. We also have po a talk ngayon on breast cancer survival. Yes, you can survive breast cancer with the love and support of your family and of course with faith in the Lord. Maraming salamat po and good afternoon. Thank you.